You're listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician that combines the wisdom of natural medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimal health. She focuses on evidence-based nutritional therapy for food allergies and in bioidentical hormone replacement. She is a twice published author, a long-standing member of the North American Menopause Society, and a certified menopause practitioner. We are on a mission to empower you with the knowledge and expertise that Dr. Marzell has earned throughout her career. We hope you enjoy and want to thank you for being with us today. Without further ado, here's Dr. Marzell. Enjoy the show.
How do you know if the doctor that you are going to is well educated in hormone replacement therapy and can really help you with this? Hormone replacement is such a confusing field right now, but there are actually some clues. So let me tell you about a couple of the things that I see that doctors have trouble with patients, and they're little flags that maybe you might want to consider going someplace else for your hormone prescription. Anyways, the first one is uh, what if you have not fulfilled the textbook definition of menopause? That is, that you have not had a period for 1 year. Now, do you know that a lot of doctors will not treat a patient with hormones if they have not reached this particular uh, time frame? Doesn't that seem kind of silly? I had a patient the other day, and I would like to tell you about this. She went in to see her primary care doctor, or maybe it was even a gynecologist, and she complained about having hot flashes. She stated that she had them all the time. They were driving her crazy. She couldn't get sleep, and she was just very uncomfortable. Well, the doctor did a very thorough history exam, did everything, and I got his chart notes, and I'm reading through the chart notes, and at the very end, he just let her go. So he did absolutely nothing to treat or even address her main complaint of hot flashes. Why should a doctor wait for menopause in order to treat a patient who has symptoms like this? Now, hot flashes, let's talk about those for a minute. Hot flashes are not a benign condition. You may not know this, but PET scans have been done with women who are having hot flashes. And during that time, the brain is kind of squeezed. And, yeah, it's not a good thing. It's not a healthy thing. Vasospasms and hormones kind of going crazy up and down is what happens during hot flashes. It's not good for your body. And it's uncomfortable. And yes, it does interrupt sleep. And, there's other things going on that you may not realize while you're having those hot flashes, such as you may be losing bone. You may be developing some plaque in your arteries. There's all kinds of things that estrogen does. But when you start having hot flashes, that means you are changing your levels of estrogen and it's lower. The body is not happy when estrogen levels start to fall. And when they fall, a variety of bad things start happening to the body. So here's how I approach things. If a patient is showing signs of estrogen deficiency, and this may or may not include hot flashes, why not give them a little estrogen support? This will even them out, will take away the hot flashes. They'll still be having their periods, but it will even out their hormones and take away the symptoms of low estrogen. I think that anytime a doctor has the opportunity to take away symptoms of discomfort, pain, or uh, other things, uh, he or she should act and help that patient. So that's one thing to watch for. If they say, oh, well, another thing I get in chart notes from other doctors, I see this quite a bit. She has not been proven to be menopausal yet. Proven means that she hasn't waited for a year of suffering with no periods before she is given the opportunity to be treated. So that is gripe number one. Stay tuned for more gripes.
Thank you so much for listening. If you enjoyed today's content, please feel free to share with a friend and help us spread our message. If you'd like to learn more about Dr. Marzell, please visit our website at www.drmarzell.com. Until next time.